Dr. Luckey.
Dr. Luckey, it's so good to have you back because we have a lot of questions now we want to ask you when you're not in the middle of surgery.
Thank you so much for having me back.
Yeah.
I appreciate it.
The last time Dr. Luckey was here, she sewed Amy's ear shut.
Well, yeah, I had ripped my earring ripped all the way through, and she sewed it back together. And since then, I've had like a couple follow-up appointments at her office, and my ear is healing nice, no infection. And I think in like 2 weeks, you can pierce it again, right?
Absolutely.
Okay.
Have you ever had anybody jerk one of those out themselves just by talking? Because that's what happened. It didn't get caught on anything. She just was talking with her hands so much, she ripped it out herself.
Absolutely. So that is one of the most common ways because over time, especially based on placement, if the ear piercing is lower on the lobule or on the portion of the ear that's pierced and it's closer to the edge, it's very easy for that to rip through over time.
But I mean,
it just stretches and stretches.
I get it if it's a shirt or
was
like
hanging on
you
its
walk
last
into
thread.
a fence. Like she grabbed it with her own hand and ripped it out.
Yeah.
A little bit, you have to be like, okay, clumsy, but you don't say that out loud.
Oh, absolutely not.
Of course not. No, of course not. I didn't know that you and Eddie had seen each other. Eddie saw Dr. Luckey?
Yeah, I see her at the football field because I guess our kids play football the same place. And so I see her walking. She's wearing the I saw her the day that she did the surgery. And so I said, Dr. Luckey?
Isn't that how you recognize me? Usually
the
I'm
scrubs.
incognito. I'm trying to hide out from patients.
And were you surprised that somebody was yelling Dr. Luckey at a football game?
No.
Okay.
No.
So
But my last name, my married last name is different. So my children have a different last name. So I know that if someone calls me Dr. Luckey, they know me from my practice.
Got it.
Got it.
That's a cool name. I would not change my name either.
And that same day, she was like, will you please tell Amy to call her? I've been trying to get a hold of her. I'm like, that's Amy. I can't help you.
Oh, yeah,
really."
same for me. She didn't get
Yeah. Well,
You can't get a hold of her until she gets a hold of you and then doesn't let go for like 3 hours. Right, Amy?
She's a busy lady.
there was like
popular.
there was just like a concern about infection, and they need to talk to me. So
Little concern, no big deal.
Yeah, we figured it out. Oh, because I wasn't going to take an antibiotic, and she wanted to call me in a prescription, and
Right.
I'm like, it's all good. I'm not going to take it.
Did you?
I'll take the risk. Nope, I didn't take it.
And it was all good?
Yes, thankfully.
Okay.
Yeah.
Dr. Luckey is MD, is a board certified female plastic surgeon who specializes in reconstructive surgery of the body. Dr. Luckey's love of medicine began in high school when she was trained to be a medical assistant and worked in an internal medicine office. Is that correct?
Yes.
Okay, I just want to make sure I had all that right.
absolutely.
So, if somebody doesn't call you doctor, can I call you Natasha for 1 second? But I'm not going to for this segment. But if they're like, Natasha, are you like doctor?
No. I think the people that have a problem with someone referring to them by their first name are people with big egos, to be honest with you.
Interesting. Bobby does that sometimes.
Dang it. I'm like, Dr. Bones, please. Dr. Bones. Okay, I have a lot of dumb guy questions, okay?
No, there's no dumb questions out there.
So my jaws, I've broken 3 or 4 teeth because I grind so hard. And not even grind, but clench even when I'm awake. So my dentist, and it helped a lot. He shot Botox into whatever these are here, the muscles.
Masseters.
And then in my head into the temple part.
Temporalis.
And it has helped, I would say 65%, which is massive for me because I have no broken teeth. So what does Botox do just generally, and why does that work on me?
So Botox is a neuromodulator. So it actually works at the neuromuscular junction. So it affects how your muscles move. So it will work for as long as it's effective at that neuromuscular junction, and it works to paralyze the muscles. You won't get a complete paralysis of the muscles unless you're over-injecting that area. So that's kind of the art of injecting Botox. There are medical uses for it. People use it to thin their face or make their face have a more round appearance. Some people use it. They do trap talks for...
You can shoot that in your traps?
Wow.
yeah.
For
like
for bigger
tense
traps?
shoulders? Or-
I like it. I'll take it in my traps.
That's what I
It's
thought.
not for that though.
No.
Oh.
It actually gives your neck a more lean, thin appearance. So it wouldn't be something that men probably are drawn to. Usually men like to look bulky. Women like that leaner, elongated look. But it works to decrease the amount of tension. But you're using an entire bottle of Botox. You're using 100 units, which most women usually use about 20 to 40 units per session of Botox.
How much does
on their
Botox
face.
cost? Like if you're just gonna get normal, random, somebody comes in and goes, I want to Botox my face.
Depends. Are you having a Botox party out of your house?
Is that a thing?
Yeah, that's a thing.
It is?
It is. So it's back alley Botox.
That's not true. There's no way.
It is is true.
No,
it is true.
It happens.
Really?
Yeah.
Yeah.
Who does the needle shooting?
Well, I mean, on like Real Housewives, they have Botox parties at their houses all the time.
Absolutely. It's kind of a concept
do
of
you
mine.
go and do them?
For
you can't.
friends. For friends, I will.
but you can't-
I don't do Botox parties.
That's what I'm saying.
Yes, because I'll tell you why I don't do it. Because your malpractice insurance only covers you in one location. So if you're
Really?
yeah, so these people, I mean,
They're
there's
shooting themselves up with needles. There is
or
no way.
there's a nurse injector who's going and she's injecting, but
Sounds
she's
illegal.
working under the medical license of someone.
Citizens arrest if it were me. I hear about this.
So what if someone's driving along? You know, sometimes I see like flashing signs like, "Hey, Botox, $7 a unit." Like,
Sounds good, I'm in.
Sale. Like, is that
Put in my trap. Sell it into
okay,
clearance.
or-
Botox clearance sale.
I think it's, it depends. Buyer beware. I think this is where your judgment, your good judgment comes into place. I'm a board certified plastic surgeon. Who better to inject your Botox? Are there other people out there who will do it cheaper? Absolutely.
Oh, so anybody?
Anybody who has who has a license to inject.
So
So,
any nurse?
depending, it varies state to state. There are different rules in terms of who can inject in what state. But yes.
So talk to me about what a filler is, because sometimes I see people like their faces are like all filled, and I'm like, why would they do that? But I'm assuming there are also good fillers that I don't see that don't look like duck, right?
Yeah. So non-duck lippy.
Yeah, because sometimes you're like, what do they do to their face? But I'm assuming there's got to be a version of that actually is done right, and we don't even notice. It just what's the reason for fillers?
So the reason for fillers, so there's a continuum. People usually ask me, how do I look younger? And usually I say, hey, it starts with good skincare, followed by Botox, fillers, lasers, et cetera. It's a whole continuum. It's like the number one party question when I'm asked or someone knows what I do.
Sure.
But in general, fillers fill the wrinkles, whereas Botox
They
prevent
fill the wrinkles. That's what they're filling?
Yes, they're filling the wrinkles. Now,
Did
sometimes
you guys know that?
Nope.
I didn't either.
Clue.
So sometimes they're used for other reasons or other indications. You might want the area to look a little more full so that it helps lift the appearance of your midface. Some people use it to make a more defined or discrete jawline. Some people use it, there's liquid rhinoplasty. So you can actually fill in divots or depressions or areas that you don't like in the appearance of your nose.
But sometimes people go too hard, right? You've seen it.
Absolutely.
mostly in the lips?
Oh, yeah.
There is definitely an ethnic preference. So I think you have to be careful when you're injecting someone. You have to figure out what their preference is. What is their aesthetic in terms of the lip? Most patients that I inject prefer a more natural look, but there definitely is ethnic differences among all the races.
Well, and I exercise a lot, and I work hard, and I eat right, but I still got like this layer right here on my stomach. A little bit too. I had surgery when I was a kid. I have a scar that goes down, so I have scar tissue through here that they're like, you need to work out scar tissue. I'm like, shut up. And so, but I can't, all this doesn't go away. If I were to go, Dr. Luckey, I need liposuction like on this part right here, how long would I be like laid up in bed?
I think it's really dependent on your tolerance of pain.
None. I have no pain tolerance. Yeah, very little.
So there are things that we can do during the procedure itself that will give you a little bit longer lasting pain control. We can add anesthetic to what's called the tumescent, which is the solution that we use to inject prior to liposuctioning. Liposuctioning is just essentially sucking out your fat through a cannula, a small cannula. But we use a wetting solution so you don't lose too much blood. It has epinephrine in it, and it usually has some numbing agent in it. So that will provide some form of temporary pain relief. But liposuction is pretty aggressive. I'm sure you guys have
It
seen.
hurts.
It hurts. It hurts. Depending on how much you have to liposuction or sculpt, it hurts.
So, like this much.
I can't see through your sweatshirt.
I'm not showing you the real thing because I'm embarrassed, right, everybody?
So he's like in bed for like a week,
A week?
a day.
I can take a week and work that off with sit-ups.
Well, see, that's what I tell patients. A lot of patients have the misconception that you can actually lose weight through liposuction. No dice. I mean, your BMI has to be relatively low. Less than 30 is what I say, because it's not a weight loss technique. Because it's not that the fat will come back. That's the number one question that I get in my office. The fat doesn't come back. But if you gain weight, you're going to gain it.
In other places?
It doesn't travel anywhere else, but you gain it disproportionate, right? Disproportionately, I should say, because you've already removed permanently the cells in whatever area that I'm removing them. So if you gain 10, 15 pounds, there's a set point theory in weight loss theory in medicine that you have a set number of fat cells. And so if you remove a set number through liposuction, when you gain weight, the other ones swell. It's not that the fat travels to other parts of your body. It's just that you have a disproportionate ratio of swelling in that area. So let's say I had my thighs and lower half liposuction and contoured. If I gained weight, I'm going to gain it most likely in my arms or my abdomen, right?
I don't think I want to do it anymore, guys.
You changed your mind?
I was just going to ask, maybe we can do it over here.
Live on the air.
Suck
Maybe we. Dr. Luckey, MD, a board certified female plastic surgeon who specializes in reconstructive surgery of the body. So, a couple questions. What is a tummy tuck, and who is good for a tummy tuck?
A tummy tuck is a procedure that most patients want to have after they've had multiple pregnancies and their muscles might be a little stretched out, their skin might be a little stretched out, they might have discrete areas that would be amenable to liposuction or contouring of the abdomen. And it's a procedure where we go in, we essentially unbutton the belly button, we dissect up.
You unbutton the belt. You
Yes.
like take it out and go in?
No, we cut around it and we
Okay.
elevate all the skin up, depending on the type of
Okay.
abdominoplasty. There's varying types. But we elevate all that skin up and then pull that down and then rebutton it through that anterior skin. So it tightens the skin, it improves the contour, and while we're in there, we fix the muscles, which are often split after childbearing.
Is that something that takes a long time to get over?
Oh, I would say it's probably the most painful surgery in all of plastic surgery.
Wow.
Yeah. I
But
think-
is it the one that people want the most because it's just affected their body in such a way that their confidence is gone?
I think that after having a baby, 1, 2, 3, however many that you've had, I think it does help restore women's confidence. It restores the anatomy, which is, I think, so important. A lot of patients will come in with back pain, and that back pain can be exacerbated by the split in the abdominal muscles because the pull, the physics of the muscle, it's not pulling in a straight line anymore. It's pulling on a curve because there's a space in between your two paired rectus muscles. So I think that not only does it restore the function, it restores patients' self-confidence and brings their body back to pre-baby appearance.
What about after you breastfeed, if you have a kid or two kids, and someone wants to have their breasts, is it augmented?
Mhm.
Would that be the term used? Like an augmentation, is it augmented? Is that the actual verb of it?
That's the actual type of procedure we would do. That can be done with implants or without.
So, and I assume that's pretty effective and pretty popular. It's like, I just would like to have my confidence back from pre-baby.
Exactly. And when paired with a tummy tuck, it's commonly referred to as a mommy makeover.
It's like a combo meal.
Exactly.
Do you get a
Exactly.
discount if you do them both?
Actually, you do with anesthesia and facility.
Oh, I guess because you're using that one at both. You're not like cutting 12% off because it's like BOGO.
Not a 2-for-1.
BOGO with Dr. Luckey.
I try not to do that because patients will talk themselves into doing procedures that they may or may not actually need based on price. So I try not to do that.
And who's here with you, by the way?
This is Natalie, my
Hi,
sweet
Natalie.
esthetician.
Hi.
She's so skilled.
So esthetician is skin.
Yes, so non-surgical skincare.
Okay, so I don't have a skincare routine at all. My
None?
wife always said none. Like I'm anti-skincare routine, but she has a skincare routine. She does it every night. She's like, you should have a skincare routine. And I say, I'm blessed that I don't even wash my face. Because if I do, I get like itches and stuff. So,
Really?
yeah. So I'm blessed that right now it's good. She goes, but then everything's gonna hit hard and you're gonna have all these wrinkles and you're not gonna be able to, and I'll make my glasses bigger. I'll cover the wrinkles by doing that. But I would assume people come to you and your expertise on just that, right? Because you can't actually make the skin go younger. It's just try to keep it where it is longer.
So kind of both. There are some things we can do now non-surgically that are anti-aging. Good skincare is one of those. The use of retinols, which is super common. Everybody's kind of heard of those
What's
at this
retinol?
point.
Is that alcohol?
It's a derivative of vitamin A, so it's going to increase the rate at which your skin cells turn over. It's exceptional at really helping with fine lines and wrinkles and kind of reversing some of that
so to
aging.
that point, there is some with skincare, Bobby, reversing that can happen because you're shedding
I
skin.
can't look any younger though. I'm gonna look like a 12-year-old. So
It's
let's be honest here. People think I'm prepubescent, so I'm gonna chill.
True.
But have you ever met people that have complexions like mine that they don't have to do anything yet?
Yes.
And knows that I feel very fortunate because that's the one thing I got.
You are very fortunate. Yeah. I was not that fortunate. I had horrible skin. And then in my time, 90s, early 2000s, we were in the tanning bed every day, which now we know is not recommended.
Oh, good point.
Yeah.
So I don't go in the sun and I don't drink. Does that help my skin?
That does help your skin.
Boom.
Absolutely.
Let's go.
Good job.
Yeah.
The fact that I'm a loser, good skin.
Actually, it's a misconception that like when you see someone that is older and they have wrinkles and they have these sunspots, the things that make them look quote unquote old, is not really the number of years they've been here, so much as the exposure to the elements, the main one being the sun. So the best thing you can do for yourself is wear your sunscreen every single day.
And not getting a tan in bed.
And absolutely not getting in the tanning bed. UVA rays are what tanning beds use, and that actually stands for ultraviolet aging rays, because those can travel through glass, as where UVB or burning rays cannot. So,
I don't like the burning either, aging or burning. Both sound pretty bad. So popping zits, good or bad?
bad if you're not a trained professional pimple popper.
Really?
Yeah, a lot of times people, whenever they're trying to pop their own pimples, cause more damage than they do actually extracting. So spreads bacteria. They scrape the skin. It causes infection. You've got a giant scab now on top of some dead skin cells and sebum that are still trapped beneath the surface. It just kind of is a disaster.
Yeah, but there's a big whitehead, and you have to like do.
Yeah, I mean,
We have to drive to your office to get a whitehead square. Like,
we do have something that I call the acne ER. And so for my established patients, they're able to come see me kind of on a moment's notice and enter into what I call my acne ER. So if you have an event, you have something coming up where you're like, I just can't have this on my face, we get them in and I take care of it for them.
okay, then do this for me. Let's be extremely pragmatic in this approach in that I have a zit. I can't get to you. I got to pop it. What's
Okay.
the best way to do something that we probably shouldn't be doing, but what's the safest way for us to pop that zit on our chin or cheek or nose?
Sure. So you want the skin to be clean. You want your hands to be clean. Now, if you have latex gloves or gloves at home, I would put gloves on. Alcohol that area off first. Sometimes I break the skin with a little sterilized pen or needle. Just kind of open that skin up. That way, whenever you're putting pressure around that pimple, you're not having to squeeze so hard or push so hard and use so much pressure. But that's not, I still can't recommend you do
I hear
that
you,
at home.
but most people, though, are not going to be able to go get it
They're going to
fixed.
do it themselves.
So
yeah.
it's like, let's find the best option for the worst thing. And hopefully
Yep.
it's not.
Clean hands,
Yes.
clean face,
Boom.
alcohol that area off a little bit, squeeze gently.
Yeah, gentle pressure.
No, not me. I go hard. It's like I got 3 seconds of time to make that thing go. And then I like to see the remnants on the mirror if it happens.
Oh,
Like I like
Like
to
if it
see, I
shoots
like to
out?
see the work. Yeah, I like to see the work.
Yeah.
it can be satisfying.
Very.
Yeah, because I just accomplished something.
You did.
What's a butt lift, Dr. Luckey?
So a butt lift, it refers to commonly when people say a Brazilian butt lift, what they're referring to is liposuction on one or multiple parts of the body, processing that fat, and then re-injecting it superficially into the buttocks area.
Oh, you're saying just take it from it and put it into the butt.
Right. So it increases the volume. It doesn't actually lift the butt. It just makes it
Ah.
bigger.
So then what would a butt minimizer be?
Losing weight.
Yeah, I mean,
Liposuction.
really? Like just liposuction? So a butt lift is just adding more butt?
It is. So there is a procedure that's known as a back lift or circumferential body lift where you're actually, there are different procedures where you can take that skin that you would normally cut off and you'd turn it over and you'd add volume to the bottom as well as lifting it. But that is a totally different procedure, and it's not commonly the commonly referred to Brazilian butt lift is actually just increasing the volume of the bottom aesthetically within different regions of the bottom.
What about, and I'm not saying any dudes specifically on this show, but we have a couple guys here that have been losing their hair. It's normal, natural, right? Eddie, Ray?
Yeah. What?
No, it's natural.
Yeah, it's a natural
But
thing.
Ray's been doing some therapy, like red light therapy on his head. It's been working, but Eddie's not been. Scooter Steve's bald. What's the deal? How can we fix that?
So, hair loss is really difficult. There have been some significant advances in the last 10 years with it, but one of the most tried and true methods is really taking the hair follicle, breaking it down into a unit, and then actually physically, manually transplanting it. And I learned this technique in fellowship. I don't do it anymore, but the
Will it still grow?
cookie, it
Like
does.
if you move a
It
plant?
does. It's like a root. So you take it by its root and you place it delicately below the subcutaneous portion of the skin, and it goes through the natural hair shedding phase, and then it comes back and regenerates. So that is one of the
You got a
best
starfish on
ways.
your head, buddy.
It's like
Get
a
going.
weed.
Yeah.
So where do you get the hair from?
So you take it
From the back.
commonly from the back. So in an area where the scar is well hidden, but you take it as a strip. You take it out as a strip, and then you dissect it. You have to have like microscopic lenses on to dissect down the hair follicles. It's really interesting.
Why do you not do it anymore?
It is so labor intensive. They have machines now that try and they try to recapitulate what we would do normally, but manually. But they're not as good because they look like plugs. Like you've seen people with plugs.
Yeah, the
It's
plugs.
not a good look.
I agree. It kind of looks like splotches.
Yeah.
It's like splotchy. Like sometimes I think splotchy skin looks like splotchy head sometimes. Yeah.
Are some people doing that though with what you're talking about, like the hair by hair that you were doing and putting it in their eyebrows?
You can do that. You
I saw that on
absolutely
TikTok,
can
and
do that.
I didn't know if that was real.
It is real.
Well, there was
Okay.
a whole trend of cutting your eyebrows way down 15 years ago.
Plucking them, yeah.
Yes. Is that why they would do that?
I think that, and plus potentially patients lose with chemotherapy or other, illnesses, and so there has been a trend more for hair regeneration. But there are different things on the market that aren't so invasive. People have done injections with PRP and different things that are having some early success.
Can you breastfeed with implants?
That is a great question. Yes, you can. The literature shows that. I think the real question here is, do any of the ingredients or constituents in the implants leach through the breast and somehow get into the breast milk? I think that's what the true question is here. And they've done studies in women with breast implants and then women without breast implants. And the silicone levels are actually higher in formula or women that don't have implants. So in terms of implant safety, that's been something that has been tested since we began using implants in the 60s.
And probably you can't even really tell unless you get in there if anything's leaking out.
Well, that's another good question. So if it depends on the type of implant. So if you have a ruptured implant, I think that's what your question is.
But is there such a slow leak, or maybe not even a leak, but let's say like precipitation, how it just over time, it's warm, it builds, maybe.
Or like in a plastic bottle that's sitting in your car and it's hot in there, and they say that the chemicals from the plastic go into the water and you shouldn't drink it. You know what I'm talking about? If they're not
Yes.
BPA.
Yes, BPA positive.
Yeah.
So I think it depends on what implant. To truly answer that question, there are two different types of implants on the market currently, and really the shells are the same. They're both made of silicone. It's what's inside that's different. There's silicone with its other ingredients, and then there's saline, which is salt water. And if a saline implant ruptures, you know immediately. It's like a ruptured water balloon. It leaks, it deflates, and you have a flat tire on one side, so to speak. If a silicone implant ruptures, you may have a silent rupture. So 30% of patients that have a silicone rupture will actually have a silent rupture. So that's why the FDA has said at the 5 to 6 year mark, and then every 2 to 3 years after that, the patient should actually have either a high definition ultrasound or an MRI, with MRI being the gold standard in terms of diagnosing a rupture.
How much are calf implants?
That's a great question. I do not do calf.
You don't do calf implants?
I don't. No.
Why are you asking, Bones?
Well, I feel like it's pretty sexist. You don't want to do a dude's calf implants, but you do all the women. I mean, if I were a woman, I'd for sure go to her. I'd want a female plastic surgeon. I'll be honest with you. I would want a female if I were a woman, I'd want a female plastic surgeon who understands my body, but I'm upset you don't do calf implants.
I'm sorry about that.
What is the most interesting request you've ever gotten?
I mean, could you throw together a calf implant real quick? You're like, I really need one tomorrow. You could probably figure it out real quick, right? No?
Oh, absolutely.
Okay.
I think that, the anatomies there, the procedures that we use, the clean technique that we use with implants, it's there.
Mm-hmm.
It's just whether or not calf implants and lower extremities, we know, and it's been kind of one of those evolving things that we know that the risk for extrusion is very high. So I don't
What's that mean?
The risk for an implant to become exposed.
Got it.
Is very high in the calf because the skin, there is not an excess amount of skin in the lower extremity.
What about
It's
chest
limited.
implant for guys?
Chest implant.
Could you do that?
Yes, absolutely.
Do you do that?
Yes.
Could you make me look like The Rock? Maybe not that big, but like, could you give me like good? I've always had the chest of a 12-year-old boy.
Yes, you can do that to anyone, but you want to make sure that whatever implants you put in match their body type and structure.
Oh, that would suck. I got 12-year-old boy implants. I'd like to get some implants. Let's match them. Okay, well, looks like you're like Timmy in 8th grade. Well, crap. Okay.
Okay.
It just feels like I like it. You're very safe. It feels like you're very safe, and you're not going to tell anybody to do any crap that probably ain't the best for them, like physically and whole.
Like you've told people no or not to do it?
Absolutely. Absolutely. I say no a lot. And I'm not really in the business of selling surgery. I'm in the business of making people happy and having good results. That's what I like to say.
I just want to get something done by it. I don't even care.
Like
I
today.
just want to spin the wheel, go to our office, let's see what it lands on, and then let's just do it. I feel good, I feel comfortable. Okay, everybody listening out there, this is Dr. Luckey. Find her on Instagram at Natasha Luckey MD. We'll also link it on our page and on our socials as well. And our website is femaleplasticsurgeryassociates.com. And I know some of the questions I ask in a joking way, but I really do wonder this stuff. I think a lot of people wonder this stuff. And I appreciate you coming in and answering our questions so clinically, but also talking to us like the idiots we are. Because we need that. You gave us both.
You guys are not
I'm like, what does
idiots.
that
I
word mean?
appreciate it.
Well, that means it's a scalpel. It means it cuts. I'm like, okay. So thank you, Dr. Luckey.
My pleasure.
And
Bobby, something just popped into my head
Okay.
that Dr. Luckey said to me when I was in her office one day that I think might be very interesting for people to hear because I've never heard it about how the Botox, like if people are getting too much of it like years later, it's going to backfire on you. And that's fascinating to me because I think people are like, oh, I'll just get Botox and I'll be fine all along, like till I get older. And then when you get older, if something goes terribly
is there a
wrong.
limit?
There is a limit, right?
Yes, there is. So that's a really good question, actually. One that I get commonly when patients come to my office for the first time for Botox. So usually patients will come with a recipe and they'll say, okay, my injector uses X, Y, and Z amounts here, here, and here. And I say, okay, that's great. I think for the first time I inject you, I would probably use half that just to see how your face responds to it. And the reason why is because I really truly feel that the muscles atrophy over time. You don't need to use the same dose that you use at, say, year 1 as you do at year 5 because your muscles actually atrophy or get smaller over time. So what happens, I feel, is that because you lose the bulk of the muscle, your skin has a tendency to look thinner, and that can make you look a little aged. So occasionally, even with my own Botox, like especially right now, you'll notice I'm on a holiday. That's okay. I'm letting my muscles beef back up, so to speak, so that my skin doesn't look so thin. I was noticing specifically in me, and I thought it was just what I was seeing in the mirror. But there was an expert that I listened to lecture who's Brazilian, and he actually says that he never injects over 30 units in somebody's face, 35 units, which is interesting theory. And then I started adjusting it in my patients, and I really saw a difference. Not everyone needs the same amount. In fact, you can start leaning out. So I think that's the problem when you go to the cookie cutter facilities.
The mall. That's where I get. That's where I go.
But
I
too
want
much. And I like that you said like a Botox holiday, like give your face a break.
Yes, everybody, give your face a break. Okay?
Yeah.
I don't want to look at it much longer. Give your face a break. Dr. Luckey, thank you so much. Natasha Luckey, MD on Instagram, femaleplasticsurgeryassociates.com. And then let's do this again in a couple months.
Oh, you're so sweet. Thank you so much for having me. I really appreciate it.
Did people be like, you're Dr. Luckey on Instagram? Anybody think you're cool or anything?
A couple teachers from
Let's
my
go.
kids' school.
Let's
Oh,
go.
your kids'
All
school.
right. All right, there she is, Dr. Luckey, everybody. Thank you, Dr. Luckey.
It's about